Jen, thank you. Everybody, thank you for joining. I hope everyone had a relaxing, nice Thanksgiving. So here we are. COVID cases have essentially plateaued up and down a little bit in New River Health District as well as statewide. As I said last week, we do expect that we will see cases go up post-Thanksgiving, over the holidays, as people spend more time indoors, as people gather more with the colder weather. But we certainly don't expect that we're going to see the surges like we saw with Delta or what we had last winter, which really kind of predated our vaccination efforts. So we do have our epi curves again this week. And I can show you what's happening locally here in New River Health District. So once again, this is the entire district, and you can see that cases haven't really gone down significantly. Remember, that last bar on the far right will fill in. So again, looking right around 200 cases per week for the entire district. And then if we go to each locality, Montgomery County, again, looks like things seem to have plateaued in that 50 to 100 range. Again, that right bar will fill in. Next, I think we have Radford City. Look at that y-axis again. You're talking numbers in the tens and not in the hundreds, in the 20 to 30 range per week. And then I think Floyd, again, look at that y-axis, around 30 cases a week. It may be a little bit down this week. We do expect that that number will fill in on the far right again. And Giles, they did have a slight bump over the week of the 16th. But again, we're talking 20 to 40. We're not talking in the hundreds there. And we do expect that last bar to fill in there as well. And I think Pulaski, same thing, looking in the 40 to 60 range. And we expect the last bar will fill in right around that range as well. And then if we go to our school-age children, you can see that overall they are down and again seem to have plateaued in the 20 to 40 per week range, which again we expect to see that fill in as well. And our community shows the same trend. Overall, college students, very, very small percentage of cases. Overall, most of them are the community. And then school-age children kind of mirror the community. When the community cases go up, our school-age children cases go up. When they've come down, those cases come down. Not unexpected, again, as we know that most of the transmission is happening at home. So I think that's it. Most of the entire district is still considered substantial in the case of Montgomery County, or high transmission for all of our other localities as defined by the CDC, the rates of transmission. So again, reminding everyone that the Department of Labor and Industry requires that employers mandate indoor masking in areas of substantial or high transmission. The good news is, though, our hospitalizations, they've trended downward, albeit very slowly. This morning, New River Health District hospitals reported 23 COVID positive patients with one person under investigation. And as before, the hospitals still remain very, very busy. They're taking care of people who put off care during the pandemic and are coming in sicker. They're taking care of the usual things that come in this time of year. We're seeing flu, and then of course COVID on top of it. And if we do see a bump in COVID cases, again, that will lead to probably more hospitalizations. But pretty much across the board, the bulk of the sickest people, the people that end up in the hospital, the people end up in the ICU and on the ventilators are those who are not vaccinated and those who have other medical conditions. As I noted last week, we are definitely seeing an early flu season with flu A, which is the H3N2 strain. Flu A definitely tends to be more symptomatic and more severe. We saw significant numbers in our university students prior to their Thanksgiving break. And they were sicker with the flu than those who had COVID as well. With COVID, they tended to have a mild cold or the sniffles, and with the flu, they were in bed, the typical got hit by a train kind of symptoms. So, again, with flu out there, with other seasonal respiratory illnesses, respiratory syncytial virus and COVID, The more cases we see in the community, that's going to reflect in the demand on our hospitals. So we're asking everyone to do their part and slow the spread of all these infections. The good news is that what works for COVID works for RSV, it works for flu as well. So good respiratory hygiene, good hand washing, distancing, being outside, masking when indoors in less well ventilated spaces. It'll help decrease the spread of all these. And we had a few weeks ago, we had the hepatitis A outbreak up in Roanoke, and hand washing is essential to prevent transmission of other communicable diseases like the hepatitis A. So pre-COVID, in the before times, most of us, if we had cold or flu symptoms, we stayed at home, took care of it on our own, went to the doctor if we started feeling really sick. But because we have so much else going on, and this is times of COVID, we are asking that people not assume that it's just a cold or allergies, assume it's the flu, assume it's COVID, but go ahead and get tested. And to seek that testing outside of the hospitals so that we're not overwhelming our emergency rooms with people coming in to get tested. So, please think about getting tested so we know what it is. Don't just assume one thing or another. Last week, I shared a phrase from an article that I had read, which I think is just so appropriate. Viruses are going to virus. That's what they do. And I was talking about how everyone is eventually going to be exposed, and people really need to start looking at doing their own risk assessment to inform their behaviors. And lo and behold, over the long weekend, we had evidence of this in the new variant, the Omicron variant, out of South Africa. And I think everyone saw the fallout from that. Markets crashed, travel border restrictions going into place, borders being closed to travel, limitations on travel, and obviously people really confused, concerned about what that's going to mean. The notable thing is that this virus has mutations, and it has more mutations than the Delta variant did. So we don't know yet, although we do suspect that it is going to be as transmissible, possibly even more so than the Delta variant. When we say virus is going to virus, that's what they want to do. They want to spread. They want to keep themselves going. As far as severity, we'll have to wait and see over the next coming weeks as far as how severe the illnesses with it are, although some of the preliminary things out of South Africa do show that it tends to be a little bit more mild, but we do know that the severe cases and the hospitalizations with the Alpha variant and the Delta variant did kind of follow it over the weeks to follow. So we'll have to see where that goes. But out of South Africa, they also noted that the people that tended to be sicker were those who weren't vaccinated, and vaccination rates in South Africa are on the lower side, in the 30% range. And that's a combination of factors. Obviously, there's access to vaccines, and just like here, people with questions, concerns about the vaccine, trust issues and vaccine hesitancy. So we'll have to wait and see. But we do know from prior viruses and studying their patterns of transmission that when they do mutate, they mutate into things that are more transmissible but tend to be less severe overall. So we'll continue to follow that and see. But we do suspect that it will continue to spread like Delta. We do suspect that those at highest risk will be those who are not vaccinated and those who have other comorbid conditions. As far as efficacy of the vaccine or whether prior infection is protective against it, we have no reason not to believe that they will at least be effective. And again, I think we set our standards pretty high when we talked about the vaccines being so effective in the beginning. And then we start hearing about how their efficacy goes down over time, and the antibody levels go down over time. The vaccines are still holding up very, very well against severe disease, hospitalization, and death. And that's what we look at. That's a public health success. And we look at that with flu vaccine every year. You know, in a given good year, flu vaccine, we may say, is 50% effective at decreasing transmission or preventing infection, but it's still very effective in preventing people from getting really sick and getting hospitalized and dying. So again, that's a public health success. And I think, you know, we have to have some of that expectation management that the vaccines are going to be effective, and that prior infection with the Alpha variant or the Delta variant is going to have some protection. We're living it real time. We still don't know how long that's going to last for anything. We have to follow it and see. And there is some suggestion that we'll have to see if the Omicron variant actually surpasses or replaces Delta. But there is some suggestion that so many of the mutations actually destabilize it, and it might not be able to do that. There are lots of variants out there that may have become important in areas where they first started, but they never really became the predominant circulating strain globally like the Delta variant did. Although we haven't officially documented the variant in the United States, I think we have to assume that it is here. The cat's out of the bag, so to speak. It's been documented in several countries in Europe. It's been documented in Australia. With global travel, it's going to spread pretty quickly and easily. So, you know, we have a newfound respect for these viruses, and we know what to do. And, you know, again, we go back to that performing the risk assessment, vaccination, masking, especially indoors in poorly ventilated spaces, trying to do things outdoors, even if it is a little bit on the cold side, bundle up, avoiding crowds, washing our hands, good respiratory hygiene, staying home when sick. Anyone who has symptoms, cough, stuffy nose, runny nose, fever, unexplained headaches, go ahead and get tested for COVID, for flu. They have a viral panel that they're running now, which is showing us that there are more things circulating out there than just COVID. But we're asking that everyone do their part, and it'll help control COVID. It'll help control the spread of RSV. It'll help control the spread of flu. And as I said before, simple hand washing can help control the spread of things like hepatitis A, which can be very severe when we see those outbreaks. So our priority continues to be, for the health department, continues to be vaccinating those who are not yet vaccinated. And again, we do acknowledge that prior infection does give immunity, but we're always going to recommend vaccination over infection due to fewer side effects. And we know that those side effects are going to be documented in a limited amount of time. The long-term effects of the actual infection, as we found with so many other infections, and we're finding with COVID, they can manifest, you know, weeks, months, and even more than a year later. So we continue to vaccinate everyone 5 and up through the health department. So the Pfizer vaccine is available for those who are 5 to 17. And we do have both the pediatric and the adult formulation. So the pediatric formulation for 5 to 11-year-olds and the adult formulation for the 12 to 17-year-olds. And then we have Johnson & Johnson and Moderna as well as Pfizer for those who are 18 and older. We are offering boosters for those who've had Johnson & Johnson at least 2 months ago, and for those who've had Pfizer or Moderna at least 6 months since the second shot. And boosters are for those who are 18 and older only. We are not boosting any younger folks, our adolescents or our children at this time. And people can choose which booster shot. And again, we have the vaccines available. So we are usually able to accommodate those. So we're doing first doses, second doses, we're doing third doses for our immunocompromised, and we are doing our booster shots. The demand for the 5 to 11-year-olds has leveled off as we expected. We know many families got vaccinated through their doctor's offices, and we continue to partner with our pediatricians' offices to supply them with vaccine, and our local pharmacies, we continue to partner with them as well. The health department continues to vaccinate at our sites, and we are coordinating with some of our pharmacy partners to offer in-school clinics, and partnering with Martin's to offer Pulaski school clinics, and we can work with anybody about getting vaccines at different events and at our schools. We are doing 2 additional vaccine clinics for all ages this week at McDonald's. Anyone who gets a vaccine will get a coupon for a free combo. Tomorrow, on Tuesday, there's a clinic from 1 to 3 p.m. at the McDonald's in Dublin on Route 100 off of I-81. On Wednesday, it's also from 1 to 3 at the McDonald's on North Franklin Street in Christiansburg. We are asking that people sign up so that we know how much vaccine to bring, but we will accommodate those who are walking in. So we asked that people visit the website, nrvroadtowellness.com, for the signups for those clinics. So I think that's all I have, and I will go ahead and take questions. I think I saw some questions coming up in the chat.
You did. And just a reminder to everyone participating, if you have questions, please feel free to ask those using the chat or the Q&A. Our first question comes from Tom. How is the district doing, with the number of flu cases so far?
So I don't have flu numbers like we do COVID, because remember, flu, we just do surveillance and it's not a reportable disease, although a lot of people still do send us numbers. I can tell you that we've had several hundred cases of flu reported, and a lot of it was in our university age population prior to the Thanksgiving break. So we'll see what happens now that folks have returned from their break, and we'll see what happens in the community. But definitely seeing a lot of influenza in the district. We just don't keep those numbers because it's not actually reportable like COVID.
Okay, next up, we have a question coming in from Allison. How do you expect the new Omicron variant will affect COVID case levels in the next few months? Could there be another surge similar to what we saw with Delta?
Again, virus is gonna virus. This is the latest variant, and we have to see whether it's going to kind of nudge Delta out and become the predominant variant in our region, in the world. So we do expect cases will go up. As I said, we're expecting cases to go up even before the announcement of the variant, just because of people gathering for the holidays, traveling for the holidays, and with the weather changing, people spending more time indoors. So it's not surprising that those numbers are going up, whether it's Delta variant or if Omicron does kind of push it out of the way and become the more predominant variant. We don't expect to see surges like we saw with Delta. We don't expect to see surges like last winter, because we do have people vaccinated. I mean, we have a substantial number of people who are vaccinated, fully vaccinated, and who've also even gotten booster shots. We have people who have had COVID, and people who've had COVID and had vaccines, which is kind of probably that super immunity there. So no, we don't expect those numbers to be in the same range as with Delta or with the prior ones, but we will continue to follow very closely, as is everything with this pandemic. We're living it real time, and we'll see what happens with Omicron coming out of South Africa, and we'll see what kind of data comes out. Again, as of this morning, most of the information coming out there was that it was very transmissible because of the multitude of mutations, so possibly even more transmissible than Delta. And remember, Delta was even more transmissible than Alpha, the B.1.1.7, which was more transmissible than the original variant. And that kind of follows precedent. They want the virus evolves to be more transmissible. As far as severity goes, again, you have to look at numbers. When you see a lot more people infected, you will see more people getting hospitalized. You will see more people ending up in the intensive care. See more people who are dying as more and more young people get infected. You'll see those numbers go up. But when you look at the actual severity or lethality of it, Delta wasn't or isn't more so than the prior variants, and we don't really have any reason to expect that Omicron would be either. And in fact, there are some who are saying that so many mutations might make it less stable, so that it wouldn't supplant Delta as the predominant circulating strain at this point in time. So we'll continue to follow it closely, but as of right now, we don't have it documented in the area, although, like I said, I would expect that it is in the United States. With global travel, you have to assume that. We do expect that, there will be cases documented in the area, and we just have to see The good thing is that the labs can sequence. Even our one lab partner, Fralin, can sequence. DCLS, the state lab, can sequence, and then the other one lab partners can sequence as well. So we will be able to follow that pretty closely.
Okay, Gene writes, so he's considering a booster shot, and for those that are thinking of getting a booster shot like he is, should they hold off for a few weeks to see if Pfizer and Moderna will tweak their formulas because of the new variants and that sort of thing?
So the pharmaceutical companies are already looking to tweak their formulas to better address the newer variants. And you know, I do suspect, as we kind of make this transition to endemic, that you will be getting your annual COVID booster like you're getting your annual flu booster, and we'll look at the variants that are predominantly circulating, and they'll use a formulation that addresses those variants. Although I will say COVID doesn't mutate as quickly as flu does. You know, again, I think that question is really an individual risk assessment. Both Moderna and Pfizer have said that within 100 days, they would probably have one out for the Omicron variant. Of course, they'd have to submit to the FDA and CDC. But I think that the vaccines, as originally dosed, are still holding up very well against severe disease, hospitalization, and death. The people that have more problems and really need the boosters or need the third shots are those who are immunocompromised or those who have other medical conditions. So I think you have to do your own risk assessment. You have to look at your own circumstances. Certainly someone who is around people who can't be vaccinated or who may have a lower response, whether they're elderly or immunocompromised, it may be that getting a booster kind of helps to protect them. If you have other medical conditions, getting a booster certainly helps to protect there as well. Somebody who is otherwise young and very healthy, waiting on the booster is not a wrong thing to do. You know, the CDC and the FDA, when they changed the booster for everybody 18 and older being authorized to get a booster, again, they use that should or can get one, and they recommended those 50 and older should get a booster. And they recommended that those basically 18 to 49 can get a booster. So, you know, again, it's knowing what your circumstances, your individual situation, your individual risk factors, and your individual risk tolerance. I think we have to expect that there will be other variants as we transition to endemic. There will be booster shots. And one thing is clear, we can't just keep boosting our way out every couple of months with a different booster. So, you know, I do think we have to look at the fact that the more people who get the vaccine, the more people who've been infected and have some immunity, that subsequent waves will be less. There won't be the numbers of the surges like what we've seen. We don't have any indication, and again, public health, you know, prior history shows us that usually when these things do mutate, that they're not more deadly. They tend to be more transmissible and less deadly. So we'll follow it closely.
Okay, Alexis asks, do you have any thoughts that you can share on travel restrictions that Biden recently added?
So I think a lot of people put travel restrictions in place just to try and get a better handle on, until we know a little bit more about the Omicron variant and limit the spread. It's challenging, right? Because I think all of us expect that the cat's out of the bag, so to speak, and it's already here. So I don't know how much that's going to benefit us. I think we really just have to see how quickly it's spreading in South Africa, where it originated, how quickly it's spreading in the other countries where we know it's been documented. I think you'll see stepped up sequencing here in the United States we can't sequence every single specimen, but you'll see stepped up sequencing looking for it, especially with people who have a travel or exposure history. And we'll just have to see if it, it didn't take Delta long to become the predominant strain that's circulating because it's so transmissible. So, I think as far as travel, again, that's one thing where people have to do their risk assessment. Obviously on all forms of public transport, including air travel, people have to be wearing masks. They are requiring proof of testing, which is not 100%, but it will help cut down on people who board planes that are actively infected. So I think those are all things that can help, but we'll just have to wait and see where it goes. I don't. It's certainly. If you're asking, do I think that it's going to keep Delta out of this country? I'm sorry, Omicron out of this country? No. I'm one of the ones that kind of is in the camp that it's already here, and we just have to wait and see what it does.
Okay, this appears to be the last question we have. So again, if you have questions, please ask them in the chat or the Q&A. Tom is asking, will we here in the NRV be testing for the Omicron variant?
So it's the regular PCR test. And we do that through our partner, Fralin Biomedical Research Institute, right here in the Roanoke area. And they are what's called a one lab partner through the state, and they do the genomic sequencing. So they will be able to detect it. Again, they can't, it's not like we do a test specifically for that variant. We do the test for COVID, and then the samples that are positive, we can do the genomic sequencing to see if it has the mutations to match this new variant. Right now, by and large, 99% plus of the COVID positive tests we're getting are still the Delta variant in our area. I do expect that, we can't sequence every sample, so they do a certain percentage of the samples that they get. I do expect that we will probably step up the sequencing a little bit, especially if we know people are higher risk, if they've traveled from that area. If they were in contact with someone who traveled from that area, and we can start looking to see if we have that variant. So, the state will be able to test for the variant. That's not going to be a problem. We have testing capacity, and we have the labs that can do it. And they'll keep tabs. As I said, it didn't take Delta long to become the predominant strain that was circulating, and they'll watch and see what percentage of cases, as they do kind of a random screening, what percentage are of that variant, and how long, if it does become the predominant circulating variant, how long it takes, because obviously if it doesn't take long for it to become the predominant circulating variant, it's very, very transmissible.
Okay, it appears we have no more questions today. We really appreciate your time. Thank you all. We look forward to the next time.
Thank you all. Thank you, Jen. Have a good afternoon.